While the Federal Health Minister Greg Hunt and his Chief Medical Officer Professor Brendan Murphy sound reassuringly knowledgeable about everything to do with coronavirus, and of course they are, it's clear that there's a fair bit of confusion and even chaos down the line with the states and in the suburbs and towns where the infection rate is on the increase. The risk, of course, with coronavirus is that the panic will do more damage than the pandemic, and that disorganisation will worsen the impact of the disease, first causing more people to be infected and then exacerbating all the flow on disruption to daily life and the broader economy. Now, with the whole of Italy and its 60 million residents now in a nationwide lockdown, schools shut, non-essential travel banned, bars closed after 6 p.m, and all public gatherings forbidden, and people required to keep a metre's distance from each other, here in Australia, we have been prepared for the worst, whilst I hope maintaining our keep calm and carry on in the meantime. And scenes, however, like this at an Aldi store in Sydney's West, yet again over toilet paper, show that more of us could have a bit more of the keep calm. But for all the reassurance from the top, a report in the Australian newspaper today shows clearer than anything else that people still don't really know what to do if they think they might have contracted coronavirus. The practical experience yesterday of the Australian's reporter Lachlan Moffat-Gray, who fears he may have the disease, was of being shunted from place to place by a health system that clearly has a full workload and still appears to be unsure how to cope with a highly infectious, highly contagious, hitherto unknown disease on top of everything else. What's needed and what's missing is a crystal clear procedure for everyone to follow in the event they think they may have coronavirus, either from recent travel to affected places or from contact with someone who has turned out to have the disease. All experts and people in authority, from federal and state health ministers down, need to repeat this procedure, this clear advice, every time they're on the airwaves, until everyone, the public and health staff, have got the message. And of course, I'd be backing it up immediately with a proper public information campaign, not spin, not political messages as politicians are often wont to do, but a simple to understand step through of what needs to happen if you think you've got the disease, where to go, and how to avoid infecting others as you go about getting help. Now, while I'm at it, if I was still sitting in some of the meetings going on in Canberra like I used to, here's a few of the other things I'd be tasking officials to get done. First, there's got to be a fair income 24/7 hotline that people could ring and not be on hold forever. That the person who answers the calls is based in Australia, that they speak good English and can step people through the information needed to help them and keep the rest of us safe. This should be backed up with an online site so people can print off information and refer to it back later. Second, there's got to be specific places ready to deal with corona cases that people can go to, or better still, how about some mobile teams that can come to them in their homes or workplaces to reduce the risk that when trying to get help, they end up infecting vulnerable people on public transport or in the doctor's waiting room. And of course, in particular, I'm thinking of vulnerable elderly Australians. Third, everyone needs to understand exactly what home quarantine means, even if they're only mildly symptomatic, and it doesn't mean going to work or restaurants or nightclubs, as we've all seen some idiots do in recent days. And fourth, for those that are seriously ill, there needs to be special hospitals or parts of hospitals set aside to deal with the disease. The standard advice for when you're sick, go to your local GP or the hospital emergency department. The Federal Health Minister again said this today. It can't really apply here because very few clinics or EDs are equipped to deal with corona cases. And the last thing you would want is significant numbers of infectious people spreading their virus to waiting rooms full of others who may already be in compromised health. And while the authorities are telling people to be sure to phone ahead and warn their GP, really, how many do you think are doing this? We also need urgent protocols for visitors to patients in hospitals and nursing homes to ensure that people who are infected but without symptoms don't spread the disease to those most at risk. Of course, all of this needs to be clarified, communicated and enforced as soon as possible. Now, to be frank, this should have all been done already, and I'm sure some of it has been at least thought of or is underway, but with the sort of steps now being taken in Italy, clearly we need to do more in Australia if we're to have any reasonable chance of avoiding a similar lockdown here. It's important to remember in all of this too that while the federal government is in charge of border controls, when it comes to the public health system and the actual organisation and delivery of health services in Australia, that's the job of the states. And while they're always happy to take the Commonwealth's money, let me tell you, they guard their role as decision makers jealously. It's the states that run public hospitals. The states, well, they run community health centres. The states set the rules about public health rules and regulations, and the states run public schools and public transport. And they also set workplace health and safety legislation. It's the state health ministers, not Greg Hunt, who need to have established sufficient coronavirus clinics with associated testing laboratories. It's the state health ministers who need to be preparing these special hospital facilities reserved for corona cases, and it's state health ministers who also need to sort out their own health workforce issues, perhaps by curtailing leave and bringing in extra staff to cope with the anticipated load. Now, so far, some of those state ministers have distinguished themselves more for buck passing to the feds than for doing the job that the crisis demands of them. And yes, Brad Hazzard, I'm talking to you. The Commonwealth is funding things 50-50 in an extraordinary move because this is an extraordinary outbreak. But now it's time for everyone else, particularly state health ministers, to lift their game.